All right, we are recording. Got my mic up, got my windows organized. We're all set. Let's turn on this camera. Hopefully, what's going on here? We want that. Haha, there I am. All right, so now everything's all set. I think we got everything lined up. Okay, cool. It's 1 p.m. Let's get started. Hello, Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cacho. I'm a physical therapist and owner of PAR5 Physical Therapy here in Randolph, New Jersey, and I partnered with Better Spaces to bring you an easy and educational workday session. So today's session is foot and ankle tune-ups, how to stay pain-free through the sand, courts, and trails. So it's summertime. It's July, right? After July 4th weekend, you've probably seen a lot of feet. It's a lot of time for people to spend barefoot at the beach or sneakered on a pickleball court or walking out on the trails, being outside in general. All of those things stress out the ankle and foot differently. This session, we're going to talk about some tools to prevent what's not commonly known as plantar fasciitis, also ankle sprains, and other common foot issues. So you'll learn how all these different surfaces affect foot and ankle mechanics, how your foot and ankle joints and bones deal with those different surfaces. We'll talk about simple balance and strength exercises to prevent ankle sprains and prevent plantar fasciitis, and foot mobility and ankle drills to work on strengthening and supporting the whole foot and lower body, and whether or not you need orthotics. So let's get into it. A little bit about me. I received my doctorate in physical therapy from Mercy University in Dobbs Ferry, New York. I also have a BS in exercise physiology from Rutgers University. I'm a certified orthopedic clinical specialist, doctorate of physical therapy, certified dry needling specialist, golf fitness instructor, and level 1 CrossFit coach. All right, so enough about me. Let's get into it. Let me pull up my slides here. And we're going to talk about foot and ankle tune-ups, how to stay pain-free through the sand, courts, and trails. All right, so because I am a medical professional, I got to always put up this slide because the disclaimer is that the stuff that we're going to be covering today is really helpful and informative, but it's geared at a broad audience. We don't want to give everything a blanket answer. So if you're dealing with something specific, make sure that you get a physical exam and have all the associated factors assessed so you get to the root cause of your problem and treat it properly. All right? So if you've been to my class before, you've probably seen this video. Basically explains how the body works. The body functions on this alternating pattern of stability and mobility from the ground up. If this pattern of alternating stability and mobile segments, stable and mobile segments, is disrupted, then usually there's a problem that happens, either pain or injury. So with the foot and ankle, that's what we're really focusing on today. The foot needs to be stable. We'll talk about what that means. And the ankle needs to be mobile. So oftentimes, this is what I see with clients that come in to see me. The ankle usually gets stiff and we lose mobility, which can cause foot problems. Or the foot becomes too mobile, which causes everything upstream to have a problem. Ankle, leg, knee, stuff like that. So real quick, let's go over what we're discussing today, this foot and ankle. So there's a lot of different bones in here. One of the ones that I want to look at and have you pay attention to is the navicular bone, right? The navicular bone is like the keystone of the foot arch. You can see in this picture here, that arch goes forward and backward. That arch gives the foot its stability. When we put our foot on the ground and we put weight through it, there is some collapse of that arch, some springiness that should occur, and generally the foot becomes mobile so that our foot, bones, and joints can conform and work around whatever we're stepping on. If it's too rigid or too mobile or too loose, then we run into problems. All right? So then looking at this is another close-up here of the navicular bone. You can see how that's like right in the middle of the arch. And whenever somebody comes in to me and say, hey, I got flat feet or whatever, there is always a degree of collapse or lowering of that navicular bone, the arch, when we put your foot on the ground. We measure that. We look at that and say, like, from comparing A to B. A is the foot in a non-weight bearing position, just putting it on the ground and not putting weight on it, just seeing what we measure the height in millimeters of where that navicular bone is in reference to the ground. And then you put all of your weight on that foot. We expect some type of drop like this. And typically, navicular drops under 10 millimeters are normal. Anything that goes over 15 or 20 millimeters, that's considered overpronation. Now, I will say this, one asterisk is that pronation is normal with full weight bearing. And specifically, when you're running and you put a lot of weight on there, full body, there's going to be some pronation, which is going to be normal. But as we step through, and once the heel comes off the ground, before we take that next step, the foot needs to turn from a mobile segment or mobile foot to a stable foot. So as soon as the heel comes off the ground to take that next step, we need to regain that arch, and that navicular bone has to come from this position back into that A position because we're non-weight bearing as soon as that heel comes up. All right, so looking at it from the back, you can see this is a neutral posture when we have like the heel, Achilles, and calf in a straight line, and we have certain degrees of what we call supination or pronation. This is the right foot looking from the back, and you have pronation where you can see how that that calcaneus bone, the heel bone, kind of collapses inward, creating that pronation, that flattening of the arch. And then on this side, we have supination, which is where that heel bone, the calcaneus, tilts outward and creates a higher arch. Okay, and then if we look at also what's in there, these are muscles of the lower leg, and the muscles also control or can influence in the collapse and the creation of that arch and position of that navicular bone. So the muscles of the lower leg, when your foot is in the air and it's not putting weight on it, all these muscles in the calf, they have long skinny tendons that go into the foot, control the foot, the bones of the foot, and the toes. All of those muscles and tendons need to pull or create tension off of a stable surface. The attachment point needs to be stable as your foot moves in a non-weight bearing position, right? But when your foot hits the ground and you put weight on it, the foot becomes mobile, and then because your foot's locked to the ground, those tendons can work and muscles can work off of that foot when it's stable and locked onto the ground. But it's in the air, there's no stability. It needs to create stability off of the structure of the foot. All right. One of the key things, I'm going to blow this up here. One of the key muscles is the tibialis posterior and the flexor digitorum muscles. Now, those are the tendons that are running right along here. I don't know if you can see my cursor there. This is the inside of the left foot, and you can see this long, thick tendon that goes up behind the ankle and up into the back of the calf. So all of those muscles that go and create this little strap or stirrup that go into the bottom of your foot from the calf help to support the arch. And they are important because a lot of times when you have an unstable foot or a foot that pronates too much, there's a lot more stress and work on those muscles. Those muscles work harder because they're trying to pull that up. And all of the weight, and you think about multiple weights, like 3 times your body weight or 4 times your body weight as you're running, walking, or doing stairs, all of your weight is on your foot. Those muscles are tiny. There's no way for those muscles to fully contract to create or maintain an arch when you have full weight bearing, all your weight on your foot. So we have some backups. The backup is what we call fascia. And fascia is this connective tissue that gives our muscles its shape, it wraps our muscles around, it kind of fills out the spaces in between. But technically, this plantar fascia is like a ligament. It connects bone to bone. And you can see that from the side view, right along that bottom, where it goes from the heel to the ball of your foot and your toes. That's that plantar fascia. Now, if you look at it from the bottom, it looks like this. It's not a solid ligament or piece of material or soft tissue. It's kind of like a web structure, right? So that's the bottom part. Now, if we look at, what is plantar fasciitis? What is that exactly? Typically, plantar fasciitis is worse in the morning when you put your foot on the ground. It's towards the back of the heel. You feel those symptoms. And it gets better as the day progresses, as you start to move and as you maintain flexibility. But if you stay in a stationary position like sitting, it may re-exacerbate or get worse again when you stand and put weight on it and walk again. So that can, with all the tension and tightness on that plantar fascia, that ligament that's underneath your foot, that can be also influenced or made worse by the Achilles. So let's blow this up here so you can see the relationship, because the Achilles, that's this white bone here, that is connected to your heel bone, calcaneus. On the other side, your plantar fascia is connected to that heel bone. If we have a tight calf, if that muscle is tight, then it can create immobility or tightness in the calcaneus. And then what happens is that can create more stress on the plantar fascia. So that's why it's so important to make sure that that ankle joint is as mobile as possible. All right. So here's I think here's a video. Yeah. So here's a video, a quick little test of whether or not you have good ankle mobility. It's called the wall test. So generally you put your foot right about 4 to 5 inches, which is probably the width of your hand, away from the wall. You keep your heel down and you push your knee forward. That heel down, foot flat position, your knee should touch the wall. If it doesn't, then you've got tight ankles. You do that a couple times and then kind of really help monitor your ankle mobility, because eventually things get tight as we use them, which we use our feet and our lower body all the time for walking, standing, whatever, and that thing can get tight. Now, if you lose the ability for that ankle to move, it can influence everything, how the body functions above your foot and ankle. So ankle mobility deficits can limit the ability to squat in this position, get to full range of motion, and also create knee pain. So that's why it's so important. I see this all the time. It's super common with a lot of clients that come in, that they lose the ability for that ankle to be mobile. And then they complain about knee pain. And if they say, why does my knee hurt? And if they treat the knee only and then reduce some of the pain, inevitably the pain comes back, or the problem comes back, because the root cause is at the ankle. The other thing in the foot that needs to be mobile is this big toe. This big toe needs to bend. That angle needs to be about 85 to 90 degrees. A lot of times people will start to lose that, because this position here, because the plantar fascia connects to the ball of your foot and your toes, creates that stable platform when your foot takes that step, right? Your foot, your toe gets into that extended position, basically this position, when you push off, and then your plantar fascia, the bottom of your foot, gets stiff and rigid, so that the muscles upstream above that in your lower leg can work and propel you forward. Now, this is what happens when ankles typically can get tight, but does have a genetic component. This is called a hallux valgus, or a bunion. If your plantar fascia gets tight, or your Achilles get tight over time with movement, walking, weight bearing, we start to get this really weak and mobile midfoot. Your foot ligaments start to get super lax and loose, and then this bone in your big foot starts to migrate out to the side, and then the big toe starts to join the other toes. And what that does is that's basically your body compensating or trying to create more mobility around a tight ankle and plantar fascia. Now, everything that we talked about, the mobility, of the ankle and stability of your foot also can influence how your leg works. Because, let me blow this up so you can get a better picture. Pronation of your foot, that unlocks the foot keystone. We talked about that navicular bone. That rotation can create that tibial rotation, the lower leg rotating inward, which creates internal rotation of the knee, which is upstream. And if we get too much of that knee rotating in when your foot hits the ground, you think about how many steps that you take throughout the day, how many times you go up and down stairs, how many times you get up and down off the toilet or out of the seat or out of the car. Every little bit of that internal rotation of that knee can create issues in your knee, hip, back, or whatever. So it's super important that the foot needs to be stable, the ankle needs to be mobile, and we need to work on that. So what are we going to do? We've got a couple things to talk about here. We're going to talk about balance, hip strength, soft tissue work, and some stretching. So let me put this down, and then we're going to pull up my two-shot here. You got me here on the main camera, and then you got the side camera here, so you can see what my foot's doing. So the first thing that we're going to do here is go through a couple tests that work on balance, all right? So in the previous slides, we talked about the relationship of the knee over the foot. If my foot collapses, then my knee rotates in. The muscles of the lower leg and the tendons that run around the bottom part of your arch and create that strap, they cannot support that arch with your full weight. Inevitably, there will be a collapse of that arch. So what do we do to help those muscles and to create an arch is to try and not let this knee go in, maintain that knee and shin over your foot. So we never want to have this position where the foot collapses. We want to kind of keep the shin and knee vertical as we push and put weight on there. And how do we control this movement? That is not at the knee, that is at the hip. The glute muscle, specifically gluteus medius, gluteus minimus, all of those tiny muscles in the hip, which typically get weak with lack of exercise and lack of attention, they basically do this move. They push or pull the knee outside, and they limit the movement inward, which is that internal rotated position. Okay, so first step, we're just going to stand up. This has to be done barefoot. The proprioceptive, or the nervous system feedback of your foot into the ground and into your nervous system, that's key for a lot of these exercises that we're going to be talking about. Besides, it is very, very useful to walk around barefoot to strengthen these muscles and get that proprioceptive feedback and have your toes move as dexterous as the hand and fingers move. A lot of times, because we spend too much time in shoes, we lose the ability to separate the toes and move one foot, one toe, and not move the other toe. Okay, so control of the muscles in your foot are key, and they're facilitated with the barefoot stance. All right, so standing on one foot. Can we stand with one foot in the air, the other foot off the ground, and hold this position? Bare minimum with eyes open is going to be 20 seconds. Now, this time can lower or decrease with age, and also can be affected by other stimuli. Like if I'm talking to you, if I try and do a math equation right now, or read a book, or watch somebody moving, or turn my head, all of that other stimuli is going to challenge the balance. If I stay focused and quiet, then my nervous system only gets that feedback of my foot in the ground, and I can stay stable and more balanced more easily. Now, the other test is going to be same thing, eyes closed. Now, we want to be able to kind of get into a same position. If we can hold this for 25 seconds, great. If you can't, don't do the eyes closed one, because you know it's going to be less. But eyes closed, you should be able to hold that for 10 seconds, okay, without flailing the arms or kind of swinging the leg all over the place. So again, minimize the stimuli, noise, talking, stress, movement, whatever, talking, listening, quiet yourself, and then close your eyes and see if you can hold for 10 seconds. So that's the bare minimum. 10 seconds is key, and that's regardless of age. If you're young, sure, you're going to be able to hold the eyes closed position for about 20 to 30 seconds. You know, if you're 50s and 60s, you want to go for at least 10 seconds. All right? Now, as things get tight, because inevitably the calf does get tight because we're sitting and not putting weight on it, this is the motion that we want to maintain, what we call dorsiflexion, flexing the foot up. All right, that's that knee to wall test. So if we have a, vertical surface, if my foot is 4 to 5 inches away from that, my heel stays on the ground, my knee should touch that vertical surface, okay? So stretching that out, we've got two muscles in the lower leg. All static stretches should be held for 30 seconds. So gastroc, calf stretch, is going to be heel on the ground. It has to be supported. You can't do this off a step. Ball of your foot elevated on some type of thing. I've got a half foam roll here, and you just bring your hip forward with the knee straight. That's a longer stretch. That muscle stretches above the knee, or it inserts above the knee and goes into the Achilles, holding that for 30 seconds. The second muscle is going to be stretched with a knee partially bent. So you're just going to bend your knee a little bit and then do the same thing. Bring your hip forward. That stretch is going to be felt lower towards the Achilles and in the soleus, which is a muscle that does not cross the knee and starts on the lower part of your tibia and fibula, your lower leg. So you're going to hold that for 30 seconds. Another ankle mobilization drill that I usually give people is repeatedly trying to move that knee forward. And with the heel locked and the ball of your foot elevated, that knee and thigh needs to point in the same direction as your foot. If you're looking down, this is probably the most important thing. We never want to facilitate or reinforce this angle, the knee in. I always want to push it a little bit out so that it might feel like totally of a foreign angle to you, because typically your body seeks the path of least resistance and compensates for tight angles. So we just go this, that feels a lot more comfortable, more natural, but that creates knee, ankle, foot, toe issues. So we want to push this into this direction, keeping the thigh in line with that same angle, maybe having your knee point towards your third or fourth toe. All right, so that's going to be about 1.5 to 2 minutes for that repeated mobilization. All right. And then if we are dealing with some, plantar fascia stuff, one of the simple things that you can do is work on some soft tissue work. So I've got some massage balls here. I've got a lacrosse ball, and I've got this trigger point ball with little spikes that you can roll and mobilize the bottom part of your foot. That feedback and that soft tissue work, whether it be done with either big ball or small ball, I think that if you spend a lot of time walking and standing, this should be done daily. Some self-care and self-mobilization for the tissue around that area is key, because we want to be able to recover and maintain our body. So that's going to be also 2 minutes. We have a foam roller, which is a little bit larger. We can get the bigger muscles in the calf here. You're going to be getting down onto the ground and then putting that calf on there and then rolling that out, different angles, left to right, inside and outside. If you need more pressure, you can cross the other leg on there and start to work that. Lifting up the hip off the ground is going to create a lot more pressure through there. And you can also feel if there's a trigger point or tight spot, you lay it on there, keep it on there, and start to move the ankle. That'll create a lot more shearing and mobilize that tissue as well. 2 minutes for that. All right. And then, oh yeah, I have like some various foams out here too, which if you need an extra challenge with that balance exercise that we did earlier, the test turns into an exercise. We can do the single leg stance on some type of foam, which is much more challenging for the smaller muscles of the foot, toes, and ankles. You can also get this thing, which is our half foam roll. This is a 3-foot half foam roll. You can kind of see that on the camera. And we could do our balance on this position, right? So I'm working my foot, working my ankle. These are strengthening these tiny muscles and the joints and ligaments in the foot to work on, creating a stable balance point. I could do different positions with this. I could do forward, backward, find the middle of that arch, work on my ankle and hip and center of gravity strategies to kind of keep my balance on here. Make it more difficult by flipping this over. And then the curved side is down, flat side is up, and then things get really interesting here because it's super mobile. You want to try and do that. And if you can build up a minute into these static positions and work on those balance, that's great. I mean, balance is a skill that we will lose as we age if we do not practice it. Just like if you don't practice cursive writing or calligraphy, it's going to be hard for that motor pattern to be recalled and do it again with proficiency if you don't practice. Alrighty, so we've got that ankle mobilization, calf stretching we talked about. Great toe stretching, super easy. Hopefully you can see me here. So we talked about that big toe. The big toe needs to extend about 85 to 90 degrees. Super simple. you just kind of grab that big toe and pull it back. And if you look at that toe angle to your arch angle or your bottom of your foot, we want to maintain that angle, try and work into that about 1.5 minutes to create and maintain that foot extension, that great toe extension, and do that for 1.5 to 2 minutes, because that's the move, that position right there. So you can see how my back foot here, as I'm taking that step, and this is like more important when you're running, that big toe needs to extend. That will help facilitate regaining that stable and good arch and position of that navicular bone that we mentioned earlier, so that you can push off and move as you're going forward or running, so that everything is straight on. Oftentimes when that big toe gets tight or the ankle gets tight, things get more sideways, where we start to step and then we run out of room, and either this happens where the foot kind of whips out like that, and that little movement there can create that bunion, that hallux valgus that we mentioned earlier that I showed on the other slide. All right. So that was a lot of fast stuff in the last 5 minutes here. So hopefully all of that makes sense. If there's anything, any questions or any problems, anything specific that you want to go over, use the chat here, or you can email me at paul@par5pt.com, because I want to make all of this stuff as helpful and informative for all of you, so you can take care of your feet, especially during the summer, because the summer is where generally people start to go barefoot. All right. All right, so if there's no questions, thank you for joining me today. You can look for this session and many more on demand on any of the Better Spaces apps. I will be back Tuesday, July 22nd. That's in 2 weeks. And the session that in the class that we're going to be talking about is Weekend Warrior Rehab, how to stay active without paying for it on Monday. So from hiking and kayaking to pickup games and spontaneous workouts, weekend warriors often do too much, too fast. This next class is going to cover how to stay active safely and recover faster. You're going to learn common injuries in weekend athletes, like low back pain, shoulders, knees, and ankles, and pre-activity mobility prep exercises for hiking, swimming, and sports, recovery routines to reduce that delayed onset of muscular soreness and joint stiffness, and when soreness is okay and when it's not. And also how to train smarter when you only have time on weekends. Like I said before, if you have any questions, you can feel free to email me here at paul@par5pt.com or team@betterspaces.com. All right, thank you for coming and be well. Have a great week.